Hello and welcome to the Practical Pediatric Medical Information Channel. Wow, that's a mouthful. I am MZMD. I'm a board-certified pediatrician. I am licensed in several states in the United States. I would like to emphasize that this video and all other videos on this channel are meant to be informational only and are not meant to be a substitute for diagnosis and treatment by your child's doctor. I hope that you will join me on these coming videos, and do not forget to like, share, and subscribe. Remember, subscribing does not mean that you're paying anything, but that's a way of notifying you when a new video has been uploaded to this channel. So let's proceed to the next topic. Today I will be discussing sore throats. There are many misconceptions regarding sore throats. One of those is that if you have white spots on your tonsils, that you have strep. That is not true. You may have strep, but it doesn't mean that if you have white spots on the tonsils, that it is strep. Most infectious causes of sore throats are from viruses. About 60 to 80% of sore throats, if it's caused by an infection, is from a viral infection. About 20 to 40% comes from infections with bacterial organisms. As you learned from the previous video on antibiotics, bacterial infections are the only ones that are treatable with antibiotics. Antibiotics do not work for viruses. So the vast majority of sore throats, which are from infections, are not treatable with an antibiotic. (20 to 40%, which are of bacterial origins, may be treated with antibiotics. The main bacterial cause of sore throats is the organism called Streptococcus pyogenes. As this video proceeds, I will refer this to the strep organism. This, for all intents and purposes, is the only bacterial organism that causes sore throats in a healthy child. So if a strep test is negative, that means there are no other bacterial causes. The only other cause would be viral. And since viral infections are not treatable with antibiotics, therefore if a strep test is negative, you do not need an antibiotic to be given for that sore throat. So can you distinguish a viral reason for a sore throat versus a strep infection by just looking? No, you can't. To be accurate, to determine whether something is strep or not strep, a throat swab is necessary. That throat swab needs to be tested for the strep organism. You cannot tell the difference between strep and a virus accurately because viral infections and strep may look exactly the same. They can both cause pus on the tonsils or white material coating the tonsils. They can both cause enlarged lymph nodes. They can both cause fevers. They can both cause red and inflamed tonsils. I also want to mention something that's called tonsil stones. There are some people who will have little white material in the depressions or crypts of the tonsils. When this material become dehydrated, they become very hard and they look like a piece of stone, so they're called tonsil stones. Sometimes we refer to these as kernels of corn, because sometimes they look like a kernel of corn. These stones have no connection to infection. They are just secretions. So seeing stones or having stones on the tonsils does not mean that there is an infection. All they are secretions. It does not mean that there is a strep infection. But again, the only way to accurately determine if someone has strep throat is by obtaining a throat swab and testing it for the strep organism. Let's speak about the throat test or the throat swab or the strep test. Usually when you go to the doctor, they will do 2 swabs. If you notice, they may do 2 swabs when they swab your child's throat. One of those swabs goes to one test and the other swab goes to a different test. The first test that's done is a rapid strep test. It gives an indication whether something is strep very rapidly, within 10 to 15 minutes. So you can have a determination if it's strep within 10 to 15 minutes. However, the rapid strep test has an inaccuracy problem in about 2 to 5% of people who are tested. So 2 to 5% of people will have a negative strep test or rapid strep test even when they do have strep throat. So if someone is positive with the rapid strep test, we will treat them as if they have strep throat. And if they are negative, that second swab goes to a different test called a throat culture. Now, the throat culture is about 100% accurate, but it takes 2 to 3 days for the results to come back. So it's more accurate than the rapid strep test, however, it takes longer. Now, the other difference between the 2 tests, the rapid strep test tests for parts of the bacterial organism. The bacteria can be dead, and the rapid strep test will still show positive if they are dead bacteria in the back of the throat. The throat culture looks at growth. So you have to have a live organism to be able to multiply and grow. So the throat culture is testing for live organisms. One other thing about testing, there are some people who will always test positive for strep. It doesn't matter when the test is done. These people are what we consider carriers of strep. They have the strep organism as part of their normal body flora. And that organism is not causing infection, it's just living there. So sometimes they will be infected with a virus, they'll have a sore throat, they'll come into the doctor's office, get a strep test done, and it's positive. It doesn't mean that the strep is causing the infection, because it's just living there. The way we determine if someone is a carrier is by doing a strep test when they are well, when they have no symptoms of an illness. If you bring them in at that point and you do a strep test, a carrier will have a positive strep test. So after there is a positive strep test, what is the next step? The next step is treatment. Strep should be treated if it's present. And there are 2 reasons for treatment. One is to obviously make you feel better. when you have strep, you have a terrible sore throat, you may have headache, you may have some abdominal pain, you'll have fever, sometimes you'll have a little bit of body aches. So with treatment with the antibiotic, it takes care of the infection and therefore will help you with the symptoms. But there's another reason for treatment, and sometimes it is the most important reason. There is something called acute rheumatic fever or rheumatic heart disease that was very prevalent before the era of antibiotics. It caused damage to people's hearts and also other parts of the body. This was primarily because of a secondary effect of the strep infection. Since we have had antibiotics and have been able to treat strep infections very effectively, acute rheumatic fever or rheumatic heart disease has become rare. However, to prevent a resurgence of this, it is necessary to treat a strep infection with an antibiotic. How does acute rheumatic fever come about? It's actually an indirect cause from the strep organism. What happens if you do not treat strep with an antibiotic and it sits there for more than 2 or 3 weeks? It will eventually disappear because your body's immune system will get rid of it. But in that 2 or 3 weeks where your immune response is building up, something strange happens with some people. Your immune response thinks that your heart is strep and will go after the heart muscle and the heart valves, thinking it's going after the strep organism. This causes damage to the heart and leads to lifelong disability from heart muscle weakness or heart valve dysfunction. The antibiotic of choice is amoxicillin, not the favorite antibiotic of everyone, which is Zithromax. Zithromax is not very effective for strep. Amoxicillin is extremely effective. In fact, for strep infections, we use a lower dose than we would normally use for an ear infection or for a sinus infection. The treatment course is usually twice per day for 10 days. Finally, let me say something about tonsillectomies. Typically, tonsillitis, and we say also pharyngitis. Pharyngitis refers to inflammation of the back of the throat. Tonsillitis refers to inflammation of the tonsils. The inflammation, like I mentioned, could be from an infection, like a viral infection, or a bacterial infection, like strep. However, sometimes the tonsils, which are actually a filter for infection and helps you fight infections, occasionally they can become a detriment. What in some people happens is that the tonsils become a harbor for the strep organism, and these people will have recurrent strep infections. So if your child is having more than 5 or 6 strep infections per year, your doctor may recommend that you see an ear, nose, throat doctor so that the tonsillectomy can be accomplished. After taking out the tonsils or doing a tonsillectomy, infections with strep will become much less common. It's not impossible. Someone who has their tonsils out may still get strep infections, but it will become much less common. So in conclusion, infectious causes of sore throats are divided into viral infections and one bacterial infection, which is the strep organism. Infectious causes of sore throats are not always treatable with antibiotics. If it's viral, it would not be treatable with an antibiotic. If it's strep, it would be treatable with an antibiotic. The vast majority of these infections are viral. So most infectious causes of sore throats are not treatable with antibiotics. In addition, strep and viral infections can look the same. They both can have pus on the tonsils, enlarged tonsils, high fevers, etc. Viral infections, however, typically come with coughs and runny noses. So typically if you see a bad cough and a bad runny nose with a sore throat, it's not usually strep. It's most likely viral. The diagnosis of strep is only accurate if a strep test is done, or by a throat swab, and the treatment of strep is very effective with amoxicillin. That concludes this video. I hope this has been informative and encourage you to watch the next video. Don't forget to share, like, and subscribe. That's all for now. This is MZMD wishing you a healthy life.